Hi everyone, my name is Alondra. I decided to do my presentation on a literature analysis on substance abuse risk factors. In this literature analysis, I will be comparing the environmental risk factors versus the genetic predisposition risk factors. All right, now let's quickly go over the why or the purpose. The purpose of this literature review is to compare and contrast both environmental risk factors and genetic predispositions and its correlation with substance abuse, with the objective of finding the most effective method of treatment. Substance use disorder is something that is very near and dear to my heart. It's something that people in my family have dealt with, that I've lost family members to, and I'm sure many of you have also, know someone that deals with it as well. According to the National Institute on Drug Abuse, 40.3 million people in the U.S. had an SUD in 2020. Out of those 40.3 million people, only 6.5% received treatment. In 2021, about 107,000 people died of drug overdoses. I included these two graphs here just to kind of show you guys the growth of drug use and overdose deaths in the U.S. In recent years. So if you can see in this chart specifically, this yellow line represents the growth and the correlation of people using opioids in the U.S. and overdose deaths. And as you can see, it's significantly risen in the past couple of years. All right, now that we went over the purpose, let's go over what exactly classifies a substance use disorder. Psychologists use the Diagnostic Statistical Manual of Mental Disorders, or the DSM-5 criteria, to classify substance use disorders, which basically means that they look at these four criteria. Impaired control. So according to the textbook, individuals with SUDs will continue using a substance even after experiencing adverse consequences with their continued use. They have a physical dependence, aka the existence of withdrawals whenever they don't have their substance. Their substance use causes them to have social problems, and they also partake in risky use. The importance of identifying these risk factors is early intervention, purposeful intervention, personalized treatment for at-risk populations, and that's something that we're going. First, we're going to talk about biological risk factors. A little bit of how I broke up this literature analysis. I reviewed 3 studies for biological risk factors, 3 studies for environmental risk factors, and 3 studies for the implications of treatment to find the most effective form. With the biological risk factor studies, I found that all 3 actually found the genetic predisposition risk factors and a link to an increase of likelihood in developing SUDs. Researchers found that genetic variants of genes like OPRM1 and DRD2, which I kind of broke down a little bit of what these genes kind of represent. So the OPRM1 gene is the opioid receptor. Its genetic variants have been linked to pain sensitivity, opioid addiction, and alcohol use disorder. The DRD2 gene is associated with dopamine regulation and reward pathways. And so these genes impact how our brains respond to reward association. What the studies also found was that there was a risk factor in brain structure. So structural abnormalities in the brain regions like the prefrontal cortex and the amygdala were seen in at-risk individuals before drug use even began. And in the next slide, we're going to go over kind of what the research they did to come to that conclusion. Now, a little bit about the prefrontal cortex and the amygdala. Let's review it. So the prefrontal cortex, again, deals with impulse control, decision-making, and working memory. The amygdala deals with emotional regulation, memory formation, and stress. Other structural differences noted included volumetric differences in the anterior cingulate cortex in an alcohol-related study that researchers reviewed. All right, let's go over the research. Now, out of the 3 studies that I reviewed, all 3 found a link between the genetic mutations of the genes that we talked about in the previous slide, DRD2 and OPRM1, and the increase in likelihood of developing an SUD. I'm not going to go over every single point, but the first 2 that I went over, candidate gene environment interactions and substance abuse, and the genetic landscape of substance use disorders, both of these found that there is a genetic predisposition risk factors to substance use disorders. The first one was a systematic review on substance use disorders and the gene and environment interaction studies. Now, out of the 44 studies that researchers reviewed, 38 demonstrated at least one significant gene and environment interaction effect. That's 86.36%. Out of those 38 studies, 34 used the diathesis stress pattern, which is something that we're going to talk about in a later slide. 100% of the OPRM1 studies found one significant interaction effect. That's 100%. 100%. That just goes to prove that there's a genetic linkage to the increase in likelihood of developing SUDs. In the second study that I went over, the genetic landscape of substance use disorders, this one was based out of the UK. This study focused more on the genetic data and the way that it can be used for preventative measures and effective treatment. So in this study, they did, again, another systematic review of studies on SUDs, including genome-wide studies. So they found that approximately with around 38% of the variability accounted for by genetic risk factors, all of those were unique to opioid use, which I thought was interesting because of the graph that I mentioned before that found that there was a rise of opioid use and overdose deaths in the US. They also went over the largest available meta-analysis on problematic alcohol use and found 29 risk variants. These risk variants mapped to 66 genes, including the previously mentioned DRD2. This study was important because it opens up the discussion for pharmacogenomic application or precision medicine using genetic mapping, which is, again, something that we're going to go over in the treatment implications slide. Now that's genetic predisposition, but what about the structural side of things? Now this study, the effects of OPRM1 and DRD2 on brain structure in drug-naive adolescents, is a particularly interesting one. The purpose of this study was to examine how genetic variants in those two genes were associated with structural differences in brain regions associated with reward processing, like the prefrontal cortex and the amygdala. Now this was a 3-year-long study. It involved 126 substance use naive adolescent females. Basically, these teenage girls underwent the baseline MRI at the beginning of the study before they ever tried any substances, and then they were retested along with their substance use behavior post 18 months and then again at 36 months. This was the first of its kind using substance use naive sample. So they found that this substance use naive sample showed consistent patterns of alterations in brain structure, like greater subcortical volumes. They also carried the genetic risk variants and also went on to engage in substance use. A direct quote from the study: in participants carrying the risk G allele for OPRM1, those who went on to initiate SU had larger left and right caudate volumes at baseline compared to adolescents who did not initiate substance use. I thought that was super interesting. So this just kind of proves that other than genetic predispositions, you can also have brain structure predispositions. Okay, I included these two pictures to kind of show you. This is going over the diathesis stress model that I said we were going to go over. Now, the diathesis stress model combines both biological and environmental risk factors. It suggests that people with genetic predisposition, diathesis, are more likely to develop a disorder when faced with adverse situations, right? So this is the degree of disorder, low to high, and then the stress level. And you can see kind of like the correlation between the two. This over here shows the interaction effects between the OPRM1 risk status and subsequent use on left and right caudate volumes in the last study that we kind of went over, going over structural differences. All right, now that we went over the biological risk factors, let's go over the environmental risk factors. In the studies that I reviewed, I found 3. Number 1, adverse childhood experiences or trauma. Number 2, their socioeconomic status. And number 3, family and peer influences. Now, for adverse childhood experiences or trauma, high ACE scores are linked to earlier onset and higher severity of substance use. ACE refers to adverse childhood experiences, including childhood trauma, abuse, neglect, and household dysfunction. Researchers have found that children living with parents who struggle with SUDs are at an increased risk for developing substance use disorders themselves. Evidence also suggests that racial and socioeconomic inequities contribute to an increase in SUDs, the main contributors being easy access and exposure to substances via household or neighborhood vulnerability. Number 2, neighborhood disadvantage and disorder. Number 3, environmental barriers to treatment, like the lack of transportation or the lack of treatment centers available in a certain area. With family and peer influences, early exposure to substance use within the household significantly increases the risk of developing a substance use disorder. Research shows that parental attitudes towards substance use can also influence SUDs. Peer substance use is one of the strongest predictors of early initiation, especially with those with underlying genetic predisposition, because of what we just went over, the diathesis stress model. All right, let's go over the research for environmental risk factors. The first study we're going to go over is risky substance use, environments, and addiction. And now, this was a systematic review of literature on the environmental risk factors contributing to substance use. This had an emphasis on public health and environmental justice, as it is an environmental justice research paper. Now, using the environmental justice framework, this study explored how environmental factors like areas with high substance density, prevalent drug trafficking, and limited access to healthcare services contribute to the likelihood of developing an SUD. These researchers found that exposure to and perceptions of neighborhood disadvantage and disorder are associated with higher levels of stress and substance use, particularly among teenagers. A direct quote from the study: research has shown an association between access to places of worship and lower rates of substance use. This shows that there's an importance of considering environmental factors in the treatment for SUDs. And it also introduces policy intervention as a form of prevention for SUDs, such as like the regulation of substance outlets, like regulating the amount of alcohol that is being sold in neighborhoods, or the investing in community development. The second study that I went over is shared environmental contributions to substance use. Now, in this study, researchers utilized data from the Virginia Adult Twin Study of psychiatric and substance use disorders. So basically, they used twins that shared a household to show how environmental factors influence substance use disorders. They conducted life history interviews to these twins and to have them report their substance use and their family environment. This study found that household substance use and parental attitudes towards substance use account for proportionate variance of shared environmental effects. This was also another 100% stat here. For cocaine, stimulant, and sedative use, approximately 100% of shared environmental variance was accounted for. Now, this is important because it gives us another form of, implications for treatment. Now, the third study that I went over, adverse childhood experiences and their association with substance use disorders in adulthood. Now, this goes over the trauma, aka their ACEs experiences, right? So the purpose of this study was to find the correlation between ACEs and the development of SUDs in adulthood. They used data from approximately 8,000 adolescents that were assessed for having adverse childhood experiences. A follow-up was done 12 to 14 years after to assess their substance use. Now, they found that adults with any history of ACEs had a 4.3-fold higher likelihood of developing an SUD. Of the 136 adults diagnosed with an SUD, 121 had experienced at least one ACE. That's 89%. 65.8% of the adolescents had experienced at least one subtype of ACE. Now, this just shows the correlation between adverse childhood experiences and substance use disorders and highlights the importance of early intervention. I'm not going to go over this again, but most of the research showed that there was a predisposition for both genetic and environmental risk factors, but most of the research should support the gene and environment interaction of both, which is, like we mentioned before, the diathesis stress model. That's where this comes in. I'm not going to go over it again because we already went over it and I'm already over the time. Now, again, the whole purpose of this literature analysis was to find the best treatment implications according to the research. And out of the research, we found three main treatment implications. The number one, precision medicine. Now, this is using genetic screening to identify predisposition for early recognition to or to tailor treatments of SUDs. So again, like that UK study showed, the use of pharmacogenetics, aka the uses of medications that target genetic risk factors, that can be a good treatment implication. For psychosocial and trauma-informed interventions, trauma-focused therapy for individuals with high ACEs can be a thing. Implementing family-based therapies to change high-risk household environments, addressing family dynamics and peer influences in interventions. A good stat for you, as of 2019, 42.7% of SUD treatment facilities in the US offer trauma-specific services, highlighting the growing recognition of trauma-informed care in addiction treatment. So you know that there's treatment centers that are already kind of using this research to provide better treatment. And the last, early identification importance and the integrated approach. So as we saw with the previous slide, gene and environment interaction is a big deal with these risk factors. So the integrated approach is really important. Using the risk factors to identify high-risk individuals and then developing integrated care plans, policy intervention through investing into high-risk communities, as we saw with the environmental justice study. Studies show individuals receiving both medication and behavioral therapy are 50% more likely to maintain abstinence than those receiving only one approach. There you have it, 50%. So yeah, these are the best treatments based on the research. Thank you guys for listening to that presentation. That was my literature analysis on the genetic risk factors versus environmental risk factors and the best treatment implications according to the research. Thank you for sticking around to the end. I wish you guys the best of luck with the rest of your studies and have a great night.